do it. Oh, how nice, it tells me that. Let's hope I can find the recording later if anybody wants it. Anyways, I'm going to guess that most of you know Bo. So I don't know how, hang on, let me admit one more person. Okay.
And I don't see everybody, so I'm not sure how to see everybody.
If you go to view in the top right hand.
Oh,
yeah,
okay.
You can switch your screen to see
I got it.
View or etc.
Thank you.
Anyways, all right. So we're gonna start. And Bo, I'm just gonna let you introduce yourself because I feel like you do it better than I would. So you just have to unmute to do that.
Yeah, so thank you, Maggie. Thank you, my fellow Democrats. It is an honor and to be here with you. A beautiful summer day in Western North Carolina. It is one of those things that you cannot beat. And thank you so much for this opportunity. It really is an honor. So my name is Bo Hess, and I am a candidate for North Carolina District 11. I was born in Lubbock, Texas. My mom was a social worker. My dad was in the Air Force, and we traveled all over from base to base when I was a child. And it wasn't always easy, but I really thought that every other child went from military base to military base until I was about in 6th or 7th grade. And I realized that actually, no, that isn't the case. But we landed over at Seymour Johnson Air Force Base, where my parents still live. And I have a beautiful niece that's 11 years old that still lives over there. I have a younger brother as well. And after finishing high school, I moved to Western North Carolina, where I've been proud to call home ever since. And, you know, I've been all over the world, all over the country. I've traveled all over, and there's no place like WNC. I have my grandparents on my dad's side are still alive. They live up in Detroit, Michigan. And, you know, as I said, my younger brother is over in Charleston, South Carolina. And growing up, my dad was in the service. He was in the Air Force. My mom was in the was a social worker. So I grew up, you know, watching them, you know, serve our country, serve our most disadvantaged and most vulnerable. And I really started learning those values of service. Also, I was very active in my church. I went to church a lot, and we went to Sunday school. And one of the big things in our church was service as well. And so after I moved to Western North Carolina, I went to school and got my associates in substance abuse counseling. I got my bachelor's in social work, and I eventually got my master's in social work and completed all the requirements that I needed to become a licensed clinical social worker and also a clinical addiction specialist. Currently, I am working in a busy psychiatric unit here in WNC. I have a small private practice. In my private practice, I treat first responders, EMS folks. I treat law enforcement officers. I treat men who are dealing with addiction. In my at the psychiatric hospital, I treat more acute and severe mental illness, such as like bipolar disorder, schizophrenia, psychosis, severe depression, suicide attempts, and so forth. I volunteered throughout my community the whole time I've been here. I've worked with Meals on Wheels, delivering food to individuals who could not make it out to get food. I have worked for years, thousands of hours, volunteered for Our Voice, and been a sexual assault advocate, and then eventually moved on to become a staff clinical consultant for them. I'm on the board of a few nonprofits that are statewide as well. And one of the things that I've been asked is, you know, what are you going to do for WNC? You know, how are you going to unite us again? And I think the first thing that comes to mind is just treating my patients and holding space for them. because I've never asked them if they're Republican or independent or Democrat, but I've always gone and worked hard for them and treated them with dignity, treated them with respect, and really gone to bat for them. And that's what I will bring to WNC, are those values. In my job, my job is actually to put practical solutions in place to people's everyday problems, right? And I've been doing this for a long time. Part of what makes this so natural for me is that it's problem solving, right? And I'm running because essentially we've run safe candidates in the past, ultimately, and we've lost. And I think we need a fresh new face. I think we need a millennial. I think we need someone who has the long view in mind. I think we need people who aren't just able to tout their own pet projects. And I need someone who will really unite everyone and bring people together. If I go to my opponents' websites, it's all about Madison Cawthorn. And that is not what our campaign is about. Our campaign is about the people of WNC. We are the most responsive campaign. That is the number one thing that we get. No matter what, they can call us, text us, email us, and a live person will respond back to you, and we will hear you out, right? Go just try to experiment, go and reach out to another one of the campaigns and see if your message even gets read, right? And I think that we need more work. I'm a working class person. I just came in from work. I think I was having great ideas and I was writing our politicians and I was hitting deaf ears. Nobody was writing back. And so I thought, okay, I'm going to do this. And, the establishment actually told me to stand down, and that's okay, that they have their own chosen candidates, but that is not how democracy works. Democracy works by as many voices as possible, as many ideas as possible coming out to ultimately the same goal, right? And so we're not standing down. In fact, that fired me up even more. And I started paying my staff at that point. And I was like, we're legit, and we're going to move forward. So thank you for this opportunity. Check us out. We have our platform on our website. I feel strongly in it. I think they're great ideas. I'd love to hear your feedback, hear any other ideas that you may have. I will write you back personally, and check us out. Join our campaign at bohess.com. And now I'd like to take any questions and just hear from you guys.
Okay, people, surely people have questions. Come on. Unmute and talk. Get my phone. See if,
I know your mom had some really good questions that she said she had written in.
yeah, and I didn't know where the questions went. That's my bad. I have to go look.
Can y'all hear me?
Yeah, Brian actually has a question right here. Brian says, can you speak about raising the minimum wage? Yeah, absolutely. I'd love to speak on that. So I believe that, $15 probably isn't even enough for a living wage, and that we need to go beyond that. Much like reforming the healthcare system, it's important to make sure that we go about these things, that it's successful, and that it's equitable, and that it works, and that it can't be something that the opposition can throw in our face, because they love to throw in policy things like, for example, let's say the Affordable Health Care Act, right? If the Democrats had it their way during that time, there would have been no mandate. but the Heritage Foundation, which was a conservative think tank, proposed that. And so the Republicans grabbed onto it. The Democrats did it as a compromise. And that was the thing that they try to annul the law with. So they're really good at doing these compromises, but going back and sticking us in the foot, kind of like what they're trying to do right now with Biden and the tax for driving on a road. I mean, the Republicans are literally trying to tax you for driving to work, and nobody's talking about this, but the Democrats is off the table because that is exactly the type of thing that they'll go back and get you for. So the thing is that the corporations, like big corporations in town, that executives are walking away with millions of dollars in bonuses while staffing isn't right and while people aren't getting paid. That is a different story than our mom and pop stores. And I think that we can raise the minimum wage for those corporations to $15, $16, $17 an hour, while also providing the tax incentives and tax breaks for those small businesses so that they're also able to pay that. But we provide a little bit of structure for them until they become profitable. And so I absolutely believe in that living wage, even beyond that. But I think that we need to provide a stepwise fashion to obtain that in order to sustain that.
I don't have a question, but I just wanted to make a comment that you won't meet a harder working individual than my son.
Can you tell she's my mom?
Yeah, I mean, that kid works so hard with everything he does and don't know how he does it. And when he told us he was going to run for Congress, I was like, what? But I know we have so much faith in him that he can go in there and do a wonderful job. So I just wanted to make that point.
Yeah.
Thank you, Mom. And that's coming from two
And
very—
Dad said too. Dad said it too.
Yeah, that's and I come from a conservative family. So when we talk about uniting people, when we talk about bringing our mountain values to Washington, I really mean that. When I say people over politics, I really, that is something that's not like a slogan. People who know me, that's something I truly believe in, like cutting through the BS and getting the job done for the people. I don't expect this to be my career by any means. I want to get back to treating people, but there are things that we need to get done. And I feel like I'm uniquely qualified, especially in the area of healthcare, to address those. Valentina had a question. It says, since you're in healthcare, can you speak on making healthcare more accessible to everybody? Yes. So I am in healthcare. I'm in psychiatry. I have my own private practice. I also work at a large psychiatric hospital. And I absolutely believe in a accessible and affordable healthcare for everybody. And I believe that this can be done at where it's a point of service free for the taxpayer, right? However, if we pass a Medicare for all law tomorrow, it would fail spectacularly simply because we don't have the healthcare infrastructure to provide the healthcare for the people who would be insured. In fact, we don't have enough healthcare providers like myself to provide healthcare as it is with so many people without insurance. So what are some things? One of the things that I am looking at is what are some fixes that we can do now, but also looking at our end goal of making sure that every American has healthcare and has the right to health, right? So, okay, some healthcare fixes that we can do now that have been shown to expand access are things that were just passed actually in the infrastructure bill. Millions of dollars went to our federally qualified healthcare centers in the rural part of our state. That brings PAs, nurse practitioners, physicians, licensed clinical social workers, and peer support specialists to those rural counties. So I will make sure and fight that we keep that funding going until we have Medicare for all or healthcare for all. We can make sure that healthcare is actually 21st century and that we move to an electronic medical record so that we are able to coordinate care. And this is something that has been shown to increase access of care and also increase quality of services. We can provide medical legal partnerships, so where doctors can actually write prescriptions for an attorney. Low income individuals have on average 3 or 4 civil legal issues that they're dealing with that actually affect their health outcomes. We can make sure that all practitioners are practicing at the top of their license, right? So making sure that psychologists are not discharge planning, making sure that licensed clinical social workers are not being case managers, making sure that physicians are all practicing at the top of their license with all of their credentials, meaning a physician is able to also provide Suboxone, for example, which helps in addiction. We can incentivize healthcare providers to move to our part of the state by offering loan forgiveness or other forgiveness programs so that we have healthcare providers here. And we can also bill for psychosocial issues. So many people don't recognize that our environment actually accounts for a lot of our health. And right now, we only bill for sickness. Our model is built on a method of sickness. And so if we're able to come into the hospital and you see the doctor and you see the nurse and the social worker does a assessment and they realize, wow, you're coming in with this asthma because you have black mold in your basement, right? Well, right now that would come out of that consumer's or that person's pocket to fix that. In my quick fix, one of the things that we can do is we can have those things that can be billed to insurance so that a provider can come. It can address the root cause of their asthma or their health so that they're not coming and cycling in and out of the emergency room. And we can also increase research and development for psilocybin and cannabis and MDMA so that we are looking at all sources of relief for our citizens and not just funneling profits towards pharmaceutical companies. So I have a lot of robust things that we can do, and all of those things will help build the infrastructure that we need for that Medicare for all and that healthcare for all. Thanks for your time. I will check you out further. I have to go and mow before it gets dark. Definitely understand that. Thank you, Brian. Any other questions? And thank you for that question, Valentina.
What do you think makes you different than the other candidates?
So what makes me different than the other candidates is a lot. I'm a working person. I'm not a politician. I believe that I've been in the trenches. I've worked behind the scenes a lot. I am not out there a lot, but on any of my social media, I never put out my volunteer work. Nobody even knew what I really did except my friends until I really started this campaign. But I think what makes me different is that I am driven. I am a problem solver. I have the team to get started on day one, and I'm in this for the long haul. And I'm not a politician. And I think that is the number one thing. You know, if we look around us, even in other parts of WNC, you know, we see rising housing costs. We see increased crime on our street. We see an open air drug use. We have increased pollution. And some of my opponents running apparently think that that is enough to get them a promotion. And I come from the view that we should earn our promotions, and that that is not enough to earn your promotion. And if that's what we want to take to Washington, then we can do that. But I'm going to make sure that the voters have a really clear alternative to that. How do you plan to weed out bad cops? What are your thoughts about body cams? Ooh, great question. So this is something that I can speak pretty knowledgeable about. I am a law enforcement trainer. I've been doing that for about 7 years. I've trained law enforcement all over Western North Carolina. I train them in crisis intervention. I train them in mental health. And I bring them onto my unit at where I work. And I actually have groups with them and my patients where we have a dialogue about what police have done right and have done wrong. I think one of the things that is surprising is that law enforcement has said we need structure, we need some boundaries around this, because not only do structure and boundaries protect citizens, it protects them. It protects them from being accused of things and lawsuits. So I'm absolutely for body cams and making sure that those cams are on whenever law enforcement is interacting with citizens. I think that can keep everybody safe. And I'm also open for, when appropriate, the transparency of those body cam footage going to the public. And some other things that I support are also duty to intervene laws for law enforcement. So making sure that if law enforcement, if an officer sees another officer doing something that they know is against protocol, that they actually have the duty to intervene in that situation. I also support hand-to-hand, 1 hour of hand-to-hand combat training for law enforcement officers and 1 hour of gun and weapons training for law enforcement officers per week. And in jurisdictions where this has been implemented, they have lowered not only workers' compensation rates from law enforcement officers, but they have actually lowered injuries to citizens, because often law enforcement officers aren't put in fight situations or in gun battle situations every day. And so when that happens, they have a HPA amygdala response that fires off, which hijacks their behavioral response. And if they're training every day, 1 hour a week, every day, then that HPA access response is less likely to happen. And we're less likely to have the incidences that we see all the time in the news. And I'm also for making sure that law enforcement officers have all the mental health resources they need. The thing about the people, even not law enforcement officers, people in other professions will say is, I can't let my superiors know that I'm in therapy because I may lose my job. It may move against my promotion, which keeps potentially officers who have their own healthcare stuff, addiction, maybe depression, anxiety, and really making sure they have the resources they need without it affecting their job, but making that a law that you cannot lose your job for that. That is important. Thank you.
Anybody else with a question? Surely so of you have a question. We heard that it's going to cost you several $1 million just to run in primary. Do you have a plan for getting out there in front of people and raising that money and really basically getting in front of people?
Yeah, so I'm getting out there every day. Every day I'm calling Clay County, Cherokee County, Graham County, making connections with voters. If they don't answer, I'm sending them a text, letting them know we're out here. I'm talking to everybody I can. Um, uh, Getting out to Bakersville this weekend. I'll be in Henderson County. We'll be in Mitchell County. We'll be back in Madison County July 19th, I believe.
29.
July 29th, that's right.
29.
Very excited about that. And I think that's in person. So yes, we're getting out there. And that's been one of the struggles for me as a candidate, and something as just a lay person who's not a politician, that I've really kind of struggled with, is this asking for money and just how much you have to do that, and just money. And I didn't realize that. I know that sounds, I don't know, I guess that sounds really naive, but that's been a struggle. Not a struggle getting in money. We have supporters and people reaching out every day and donations. But I don't have a, nonprofit or something that I'm working out of, where I already have a ready list of donors at my fingertips. And so, we get that we are the underdog, and that we are, that in a lot of ways, but we really feel confident that when we get out there in front of the voters, when they meet me, when they understand my background, the qualifications, what we're bringing to the table, our ideas, that we will be the clear candidate for the primary. And then for the general election, it's a whole nother ballgame. But essentially, we are running the general election now. I mean, I want to be a very positive. I want it to be very unifying. We will always have those haters out there. We will always have the people who want nothing to do with us. And that is okay, right? We right now are in the building capacity phase, where it's just talking to people, making those connections, reaching out, letting people know we're in this race and we're not bowing out. And that we think that once we get really into it, we will be the clear front runner.
Sorry, my husband's setting up the vacuum cleaner. It just made noise. I didn't know what it was.
Any other questions?
In your travels around the district, what kind of issues have they brought up? Because like Madison County has like broadband internet connection is a big thing here.
Yes. Good question. So this has been something where I've just loved talking with people, loved hearing the feedback. So few things that have been themed. The environment is huge. I think probably environment is the number one thing that we get. And that makes sense. We're in Western North Carolina, right? Also, cryptocurrency is a huge thing, and AI technology, just all things tech and data. And then the other thing has been infrastructure and broadband, and making sure that we're not left out. And that is the difference. I'm on the board of North Carolina Harm Reduction Coalition. We passed the most progressive laws that were most compassionate for people who were addicted to substances in the nation under a Republican legislature, because we knew how to work with other people. We had a strategy. We were respectful. We met them where they were. We framed things in ways. That's the difference between me and especially the incumbent right now, is he's out here worried about whether he can afford Jimmy Choo shoes, and not worried about whether the citizen can actually afford their medications or the roof over their head for this next month. And I know I'm not really trying to be funny. That is actually,
you're absolutely right, though.
It's absolutely insane. Yeah. So that's the clear difference between the incumbent and myself.
Okay. If anybody has any questions, you just want to put them in the chat box, that's fine too. not.
So, got another question. I know you want to legalize cannabis. What age do you feel that is appropriate? Good question. So, as somebody who, for some people, it's never appropriate. For some people with mental health issues, severe mental health, it might not be appropriate. The issue that we have with not legalizing cannabis is that we don't actually know, because the federal government has kept cannabis illegal. So we don't have any research and data on what it can actually help with. So I think 21 is what most states have started at, all states have started at, and I agree. Although the brain really doesn't stop developing till, 25, 26, 27, 28 at times. So I think for different people, it's going to be different. The ultimate thing is that it's a social justice issue and it's a freedom issue, and people should have the right to choose and have the right to choose a product that is safe and unadulterated, that is regulated. So if there are no other questions, oh, I got another question. Can you talk about your priorities when it comes to the environment? Yes. So that has been one of the things that I look and study the Green New Deal. And while there are some things in the Green New Deal which I think could be achievable and measurable, there are other things in the Green New Deal which I feel like are less measurable. Essentially, it all boils down to, can we actually achieve this thing? And how do we know when we've achieved this? I come from, the social sciences, and we are all about data. We're all about the research. And so I support no drilling, in which they've already established is not going to happen in Alaska. I support maintaining federal wildlife reserves and forests. And I support research and development and looking at more environmentally sound ways to farm animals, and to also cut down on things like superbugs, like bacteria and viruses that often happen on these farms. One of the biggest contributors to greenhouse warming is actually methane from the cows. The environment is a top priority, and it's something that is important. There's a Justice 40 initiative that also I support from the Biden administration. And basically it is a law that says that we can't build in underserved communities. Typically our trash dumps in places that are really high pollutants are in low income places. Also creating incentives for manufacturers to go green. I don't think we should mandate, the government should be mandating these things. Again, I think the government should be incentivizing the free market to make the right decisions. And I think we have too much government overreach as it is, and people bristle at government overreach. But I think people will naturally do the right thing, or sometimes they'll just go out of business, or people will know they're not as green. And then also really making sure we're funding FEMA and providing disaster relief more quickly to underserved populations. We've seen in past disasters where more wealthy parts of town were tended to. And so making sure that we have more equitable response from the federal government. Again, I'm looking at things from a federal level because I'm running for federal office. And then making sure that we're enforcing United States laws on poaching by Americans that go overseas. One of the horrendous things I saw the Trump kids do is go over to Africa and shoot endangered species. I mean, with all the billions of dollars in the world, I guess shooting endangered species is something that is going to fill that hole of yours. But making sure that we enforce those laws and increasing the severity of sentences for animal cruelty and making that a federal crime.
How about broadly immigration and immigration policy?
Great question. So I believe in the rule of law. I believe that people should come here legally. I believe that, but also I believe that we have really disincentivized individuals to follow the legal path to citizenship by how cumbersome we have made that path, right? So I think that it should be an all hands on deck situation on the border. Kids should not be sleeping in cages or foil beds. We should have every nurse, we should have every public health service worker, every bilingual social worker at the border helping process these humans, making sure they are going to a safe place, most likely back to their home country, and making sure that we address the influx. But then also making sure that DACA, our dreamers, have a path or are supported and can become citizens, and that the people who are here and who haven't committed any crimes and maybe have come illegally, that there is a path to citizenship that they can take. What that looks like is complex, more complex than I think we have time for. But ultimately, this is one of those things that I think the Democrats get so wrong, and we lose elections because of this issue. And so on the record, I believe in the rule of law. I do not believe in an open border. I believe it should be an all hands on deck situation at the border. And I also support our dreamers, and I also support at the federal level, making sure the process to citizenship is less cumbersome.
Okay. Does anybody have anything else they want to know?
I had one comment. As a social worker, I worked with many undocumented families because I'm bilingual, and worked with them for over 20 years. And so, son, a question for you is, there's a misconception that many undocumented workers do not pay taxes and do not pay into the economy, which is not true, because many of the companies are hiring them knowing that they're illegal, that they're here undocumented, and actually are taking taxes out from their paychecks, and even those that work in the farm. So how will you help dispel that misconception when you get to Congress? Because this is a topic very near and dear to me.
Right. So, I think one of those things is again, it's about less government reach and regulation, and more incentivizing to do the right thing. So maybe creating some sort of mandated reporting system for people who know about employers who are taking taxes out, and reporting that to a special IRS or in some sort of enforcement or hotline, so that can be investigated. But I think you're absolutely right. I mean, not only do the taxes not only are they taken out in that way, but when you buy anything, when you're spending money and there's a tax taken out, you know, you are taking a tax out of that money. You know, immigration is such a complex issue. What I want to make sure I stay away from in this is any hints of racism or anything like that. You know, racism is something that this campaign does not tolerate. I've never understood racism in any of its forms. And it's hard to even though like in Western North Carolina, the majority of undocumented people are actually of Russian or Ukrainian descent and not of South American or Central American descent or Mexican descent. So, you know, I just want to make sure that we're speaking about people humanely and just as people who have broken the law as the law is right now, and understanding that this is a piece of our federal legislative code that is the most broken and the hardest to enforce. You know, we are the greatest country in the world. We're the United States of America. Everybody looks to the United States. Everybody knows what we're doing. Everybody wants to be here and come here. And so recognizing our strengths and recognizing that we need to take a more humane approach, even a more humane approach and a more urgent approach than the Biden administration is taking at this moment. Thank you, Mom. And I have learned a lot from Mom on this and read a lot, and it's important to just hear and understand as many points of view as possible.
So, any more questions? I'll take that as a no. We are very much looking forward to having you come out to Madison County on July 29th, 6 o'clock in person. So tell everybody who lives close by. It's a nice extension center room. It's got plenty of room. The other 4 of the other candidates have confirmed they're coming. So there are 5 of you right now.
Okay.
Looking forward to it.
We will be there, and we are just grateful, Maggie, for the opportunity. Thank you again for taking the time. Thank you, everyone who is on this call. Really is an honor. Remember, join us, fight alongside us to bring real representation back to WNC, and check us out at bohess.com.
Thank you so much for coming out tonight.
Thank you.
And thank you to everybody who joined. Not that I can see any of you.
Thank you, Maggie. I
Thank
love your
you.
dog.
Thank you. She's yeah, she's something. Well, good night.
Good night.